Hello, everybody, and let me welcome you all to the Institute for Healthcare Improvement's 2021 Forum on Quality Improvement in Healthcare. I am Mike Dowling. I am President and CEO of Northwell Health and Chairman of the IHI Board of Directors. This is the second year in a row that I am addressing the forum from my office, staring at a screen, instead of from a stage looking out at thousands of hopeful faces. And of course, it's sad not to be able to meet in person, shake hands, ask an IHI blue shirt for directions, or have spontaneous discussions in the hallway. Many of us who have faithfully attended the forum for many, many years surely miss those moments. But from another perspective, the fact that we are still able to assemble despite the extraordinary challenge of the past year and a half is inspiring. We're using the tools at our disposal to change how we do things so that we can carry on this annual tradition of learning, connecting, sharing, and recharging. Similarly, so many of us and our peers have had to change how we do things. We have rapidly adapted to unprecedented circumstances in our work in healthcare during that period. That too has been inspiring, although it has been tremendously difficult. And I want to acknowledge the sacrifices you all have made, the intense stress and suffering of these past months, and the magnificent work that you have done under extraordinary conditions. You know, the challenges that we face in healthcare make us all the more important that we find a way to connect with one another, process the effects of the pandemic, and determine how to move forward. We must use this crisis as an opportunity to do what IHI has always done and has always helped us to do, learn and improve. Perhaps some of the changes instituted in emergency mode over the past year and a half will turn out to be worth keeping. Hopefully, many will. The pandemic has also exposed the depth and extent of certain problems in our society, most notably inequities in healthcare delivery and healthcare, and redoubled our urgency to address them. Our next keynote speaker, Dr. Kedar took the position of President and CEO of IHI in the midst of the global pandemic. It has been a stressful time for IHI as well, and Kedar has handled the strain and uncertainty with unflagging aplomb. Kedar is also President of the IHI Lucian Leap Institute and a member of the faculty at Weill Cornell Medical College. He has served as a steady and inspirational leader of IHI during these tumultuous times. He has shown himself to be utterly committed to IHI's core values of love, courage, equity, and trust, which have and continue to guide him and the whole team at IHI. Kedar has also proven himself a thought leader in the public sphere, sharing insights on the long-term outlook for COVID-19 and how to prioritize equity in healthcare, among other essential topics. So on behalf of the Board of Directors, I extend gratitude to Kedar for his tireless dedication to IHI and its mission, and for his leadership in the face of such challenges. So please join me in welcoming Dr. Kedar to our virtual stage. And again, I thank you all for everything that you've done, everything that you continue to do, and please enjoy the rest of this exciting forum. Thank you.
Thank you, Michael, for that introduction. It's my pleasure to welcome you to the 33rd Annual IHI Forum. I am so excited that you are all here. I had, of course, hoped to see you all in Orlando this year. The whole of the IHI team has been waiting for the opportunity to greet you again and to share stories of improvements made, lives saved, and mistakes made that we can learn from together. We will, I know, find that time to be together again soon. But in the meantime, We are humbled by the trust you have shown us by joining us here at the IHI Forum. About 6 months into my tenure leading IHI, I had a conversation with one of our amazing project managers. Project managers at IHI are a brilliant combination of passionate improvers and practical tacticians who can get almost anything done. This individual is someone that I have worked with for years on a number of projects over time. And when I became CEO of IHI, she wrote to me to congratulate me, share her excitement, and to urge me to look towards the future. She wrote then, "I am so thrilled for you, but more, I am so excited to be a part of where you will help lead us into the future." At IHI, every leader reserves time in their calendars at least once a month, and often multiple times a month, where staff can drop in to talk about anything that's on their minds. On a cold Wednesday, I remember, I saw her name pop up in my stand-up meeting, as we call them. She was feeling dismayed. She spoke to me at length that day about some of the challenges she was experiencing in her work, with her supervisor, and with our culture. I listened, asked some questions, and mostly just offered her an empathetic ear. But I could sense she really wanted to say something that she was nervous about, so I invited her to say a bit more. She shared that while she trusted me completely, her own words, she didn't feel she could trust the office that I held any longer. She trusted me, Kedar, the person, the guy that she had worked with for many years, but she no longer trusted the institution, the office of the CEO, and the systems and structures we have created. This hurt. It hurt me to hear, and it hurt to feel. Here was a person that I had been to battle with in the trenches of improvement initiatives and customer engagements. We had done great work together, and I knew I could rely on her skills and her talents. I believed in her, and I trusted her completely. And here she was telling me that she was no longer sure that she could trust me. What on earth was happening here? Across healthcare, indeed across all of our leading institutions, nationally and internationally, we have seen plummeting confidence in leadership, institutions, and all centralized forms of power and knowledge. For over 4 decades, the polling organization Gallup has surveyed the public about their confidence and trust in 14 leading American institutions, the media, government, military, and medicine. The data are striking. Year over year, we lose more and more trust in our institutions. Confidence has fallen to historic lows across almost every major American institution. Religion has fallen from a peak of 68% trust to 36% today. In 1979, the majority of Americans trusted the media. Today, less than a third do. A 2020 Pew study found that only 20% of Americans trust the federal government, always or most of the time. And we, as a nation, have less faith in the medical system than we once did. Trust was at 80% in 1973, and in 2016, it was 39%. During the pandemic, trust in the medical system surged to 51%, the highest level seen since 1977. But in the early part of 2021, confidence had again eroded, tumbling back to pre-pandemic levels of distrust. Trust in our once venerated institutions is declining. Trust in leaders is declining. And most pernicious of all, we increasingly trust one another less and less as we have retreated into social media-fueled echo chambers where our prior beliefs are confirmed by communities of the like-minded, eager to indict the other and pontificate about the president. When masking decisions as you walk into your neighborhood grocery store become ideological statement, suspicion rises and trust sinks. Pick up any newspaper these days and read the headlines, and you will see evidence of a fragile and crumbling trust. Within our health systems, we have seen the consequences of this eroding trust every day and in every way. From challenging conversations about the value and importance of vaccines with our patients to the epidemic rates of burnout and frustration amongst our providers. The old aphorism remains, unfortunately, true. People don't leave jobs, they leave leaders. The Great Resignation, as it's been called, is not only about the future of work, it's also about declining trust. Our patients are losing faith in us. We are losing faith in our leaders. And this, in turn, is causing our leaders to lose faith in themselves. In our personal lives, as the boundaries between work and life blur into non-existence, the debates that rage at work over vaccines, mandates, and masks, we carry across the room to the dinner table, to discussions with our relatives about whether to be vaccinated or not, how and where it's safe to gather, and whether to believe our scientists or to believe Aaron Rodgers. In every facet of our lives, the question of who to believe, what to believe, and fundamentally how we can once again believe rages within our communities, within our families, and indeed within ourselves. Why does this matter in healthcare? My colleague and mentor, Dr. Paul Batalden, once helped me see this beautifully. Years ago, Paul reminded me of the work of Victor Fuchs, the Stanford health economist, who for more than 50 years ago wrote that value in healthcare is produced by professionals and patients acting together in an authentic relationship. The patient and the clinician bring different kinds of knowledge to the encounter. The clinician brings their expertise, and the patient brings their lived experience. And together, they conduct a set of activities that lead to better health. Connecting the relationship to the activity is knowledge, skills, habits, biases, and fundamentally, trust. In the quality world, we have largely focused our energies on the activity side of this dynamic: checklists, decision support, measurement, and monitoring. All of those are necessary, but Paul reminded me that it was the relationship that made those activities possible. It was as though we had reduced the therapeutic action in the clinical encounter down to providing the bandage or the medicine and forgotten the true assets that surround the patient and create better health. Trust oils the machinery of relationship. Trust allows us to understand the context and live realities of the patient. And without trust, the whole enterprise falls apart. Trust matters. It's why IHI has made it one of our 4 cornerstone values. I might even argue that trust creates the conditions for the other values to take hold. You cannot love without trust. Equity and trust share a causal connection. You cannot have trust without equity, and you cannot have equity without trust. And trust allows us to be courageous, because it is nearly impossible to be courageous, to speak your truth, without having the trust of someone who you know will back you up. Trust is how we build the future. It's how new ideas travel. It is the vehicle for change. We cannot create higher performing systems. We cannot create safer and more equitable systems without trust. And yet, it's eroding. Or is it? As I started to dig into this theme, I learned about the fascinating work of Rachel Botsman, a lecturer and trust researcher at Oxford University, who recently published a book titled, "Who Can You Trust?" Botsman cites all the statistics that I shared with you earlier, but she reaches a very different conclusion. Trust, Botsman writes, the glue that holds society together, hasn't disappeared. It has shifted. Consider the following story. Who among you listening here today would have believed me if I told you 15 years ago that you will someday fly to a city you have never been to before? You will get in the car of a perfect stranger, someone you've never met before, and they will take you to the empty house of another perfect stranger, and there you will spend the next week vacationing, all the while trusting a decentralized network of local actors to keep you safe and free from harm throughout your journey. This was unimaginable just a few years ago. And yet today, millions of people trust decentralized networks of local actors to guide us on everything we hold dear: what we eat, where we sleep, who lies in bed next to us, and even our life itself. Botsman's contention is that we haven't lost trust, but that trust today is different than it was before. We no longer trust institutions, centralized power, and traditional forms of leadership. Instead, we trust networks, increasingly decentralized, where anyone can be an author. In healthcare, there is a version of the story I started off with. I trust you, Kedar, but I don't trust your office. In healthcare, it's I trust you, doctor, or nurse, or social worker, but I don't trust organized medicine or the health system with a capital H. But is this really new? Sure, technology has enabled Uber, Lyft, Airbnb, and other companies to facilitate the decentralization of trust. But is the transition from monolithic and institutional trust to decentralized, networked, and hyperlocal trust really something new? As I was thinking about this question, I thought about my mother. She arrived in the US in the early 1970s, a newly married woman, having just met my father a few months earlier in an arranged Indian marriage. She spoke English, but it was limited, and she faced, like many immigrants, rampant overt racism and countless forms of microaggressions. She didn't call it those things at the time, and she doesn't even now, but they are all over her stories of those early days. There was no institutional authority that could help her, that she could trust. In fact, to the contrary, the institutions and leadership systems of the time were not designed to help a young Indian, vegetarian, and Hindu woman with moderate English language proficiency. And so my mother, like millions of other immigrants and millions in communities of color before her, formed her own decentralized networks of hyperlocal knowledge that she invested everything into. This became her new family. This was where she, like so many others in churches, barbershops, salons, and bodegas, found trust. She didn't let the challenges of her new life get her down. She found a community that she could rely on, that she could put her faith in, and that would be there for her through every twist and turn over the next 50 years. Notice that my mother's story and the stories of countless communities of color is not a story that depends on technology. My mom, God bless her, wouldn't know what Twitter was if it bit her on the nose. Technology does not power trust, but it does change how we trust. And technology can both accelerate our declining trust in institutions and simultaneously grow our trust in networks. While my mother had to find her community in the vegetable section of our grocery store, technology has made it so that many of us can find our people online. So what are the implications for healthcare? How do we respond to this evolving understanding of trust? And how do we restore and rebuild trust that is at the heart of everything we do in the caring sciences? For this, I have to commend the work of the American Board of Internal Medicine Foundation and its leaders and my guides through trust in healthcare, Dr. Richard Barron and Daniel Wolfson. Several years ago, they made an observation that we in healthcare had made a compact, a sort of blood bargain with society. We, clinicians and scientists, would master human physiology and genetics, and in exchange the public would entrust us with their lives. We would self-regulate our profession. We would measure and monitor progress. We would determine what mattered. We placed a tacit bet on science and technology, genomics and precision medicine, AI and data science. And we believed that the public would trust us, because many of us in medicine and nursing have built our whole approach around this fundamental belief. But in crept the pernicious cancers of what my colleagues and friends at the Billions Institute call the figgy problems: fear, ignorance, greed, and lastly, and most damning, inertia. We feared the increasingly decentralized forms of power that were arising, that were undermining trust in science. We retreated to our own echo chambers, content to listen to only those whose beliefs agreed with our own. Money, and the prospect of more money being devoted to modern medicine, made many hunger for more. And when the chips fell, and we saw the system crumbling, we were too exhausted, too overworked, and too out of time to do anything about it. In a conversation a few weeks ago, Daniel Wolfson summarized our whole mistake with one simple sentence. He said, "People don't care what you know until they know that you care." The science mattered, to be sure, but it was never the science alone that healed. It was the relationship we have with the healer. It was the caring part of health care that mattered the most of all. And of course, anchoring that relationship was trust. Over the past 4 years now, Rich and Daniel have dedicated themselves and the foundation to studying trust and finding bright spots in healthcare that can guide us. Their work is leading edge, and I urge you to explore the ABI and Foundation website and buildingtrust.org, where you can find case studies of health systems that have chosen to face their trust challenges by taking specific actions to build trust when it matters, to make care better. Through speaking with them, I found the work of Francis Frey, a Harvard Business School professor who went to work at Uber a few years ago, when the headlines were full of how Uber's toxic work culture, sexism, and harassment were failing drivers, the engineers, and customers alike. Uber had a massive trust problem, and when the chips were down, they called Francis for help. Frey's conceptual model of trust is neatly and conveniently for an IHI speech, a triangle. Frey believes there are 3 essential components of trust: empathy, logic, and authenticity. If you believe that my empathy is directed towards you, you are more likely to trust me. If you believe my reasoning makes sense, you are more likely to trust me. And if you believe I am being authentic, then you are much more likely to trust me. These 3 things, empathy, logic, and authenticity, are both where trust begins and where it can break down. Frey says the usual thinking around empathy is that we must walk a mile in another person's shoes. But of course, this is almost impossible to do because I can't really know what it's like to walk in your shoes from where I sit and from my lived experience. The breakthrough in empathy is the concept of centering someone else, choosing to spend time with another person and getting genuinely curious about what their experience is and has been. I can't walk in your shoes, Frey says, but I can center on you, and I can learn through a process of curious inquiry. Empathy begins with curiosity. And curiosity, I've learned, is both a skill and a choice. I learned this talking with Kyle Christensen. Kyle is a family medicine doc at Unity Point Prairie Parkways Clinic, and he and his wife Jennifer live in the small town of Cedar Falls, Iowa. 7 years ago, Kyle and Jennifer's firstborn child came out to them as a transgender male. Ben, their son, had experienced years of uncertainty and confusion about his gender identity and had even contemplated his own suicide. But Ben was resilient and persistent, and Kyle and Jennifer made a choice not to retreat to denial, fear, or ignorance, but instead to embrace Ben and his authentic self and become curious. And when they made that choice, they went all in. They learned everything they could about what it meant to be transgender. They learned that a staggering 82% of trans folks had considered suicide at some point in their lifetimes, and that a third of trans folks would attempt suicide before the age of 18. They heard countless stories of the medical system presenting barriers to care and actively denying or withholding needed care for trans people. And armed with that new knowledge, Kyle and Jennifer went to work and opened the first of its kind LGBTQ clinic at Unity Point Prairie Parkway. They were nervous to do it. This was a small town after all, and they really didn't know how their community would respond. They could have caved in to fear and inertia, but they didn't. Motivated by Ben's experience, they found the energy and enthusiasm, and theirs was met by even more from all over Unity Point. Leadership endorsed the effort. A half a dozen physicians and another half dozen nurses joined. Pharmacy, laboratory, radiology, and social work all came to their aid. In Kyle's words, folks wanted to do this. They just didn't know how. And when they opened the doors of the clinic and welcomed their first patient by asking them what pronouns they used, they were greeted with energy and enthusiasm from the community. Their clinic filled quickly, and they have plans to expand to 4 additional Unity Point regions and have just created the first of its kind system-wide LGBTQ learning module for all of Unity Point staff. Ben is thriving, living and working in Chicago for an organization focused on social change. Curiosity is an active choice. And when we choose to get genuinely curious, we create empathy, and that builds trust that can unleash so much human potential. Back to Francis Frey and the triangle of trust. The second component was logic. I won't trust what I cannot understand. It's hard to believe in someone whose judgment is suspect and who you don't feel you can connect to and communicate with. When we have a logic wobble, as Frey describes instability in the trust triangle, lean in to what you know best. Where do you derive your truth? And when you connect to your truth, you can share your power with others. As we considered earlier, healthcare is a service, and every service is co-produced, which means that the outcome is made together by professionals acting together with patients, combining their wisdom to create better care. And for co-production to work, to genuinely work, we have to change the balance of power. I can think of no better example of a health system that is successfully doing this than the example of Rush University's health system and its efforts to transfer power to the communities on the west side of Chicago. I first met one of Rush's leaders, Dr. David Ansel, in 2017, while IHI was running its Pursuing Equity initiative. Rush was one of 8 health systems that joined this program that sought to implement a practical framework to improve health equity. One of the pillars of that framework was about partnering with the community, something that we often talk about in healthcare, but that Rush took to a whole new level. In 2018, Rush looked at its city maps and found a life expectancy gap of 16 years between Chicago's Loop and the West Side neighborhoods that Rush provided care to. In some ways, Rush was an unlikely partner. It had some well-earned mistrust, as Ansel put it, as an academic medical system. But Rush and its leaders knew that to overcome that mistrust, they couldn't simply listen. They'd have to act in a way that would earn the community's trust. And to do that, they would have to transfer real power, money, and resources to the community. And so Rush joined a number of community leaders, sat down around a common table, and together they set an ambitious goal: to have that life expectancy gap by 2030. And together they founded a racial equity-focused, community-led, and community-driven organization called Westside United, and they appointed Aisha Jaco as its executive director. When I spoke to Aisha, she was brimming with energy and confidence. Westside United had set goals to get 5,000 well-paying jobs into the West Side and close on $20 million in new investments to local businesses in the city. Block by block, Westside United was going to build power in their community through real investment that would create real, lasting change. When we spoke, Aisha shared that a grocery store had closed in one of the West Side neighborhoods just a few days before our conversation. This was, of course, a devastating blow for the community. This was their only real source of healthy food options, and it had left the neighborhood suddenly under the cover of darkness, and the next morning the community was bubbling over with justified frustration. But what gave Aisha confidence was that the community had a place to go. They came to Westside United. They finally had something. They had a trust broker who could, they believe, help them navigate to find a solution. And that made Aisha justifiably proud. The interesting thing is that the trust brokerage of the Westside United works in both ways. The community can find its voice, and those in power can reach the community. During the first days of the pandemic, the city of Chicago was carefully studying the patterns of deaths. Of the first 100 deaths in the pandemic, 70 of them happened among Black people, and many of them were residents of the West Side. City officials knew that they had to get to the West Side, but mistrust was so dense, and they really didn't know what to do. Westside United, again, provided that trust brokerage, getting the mayor's office, health department, all of the local area providers, and community organizations around a common table, which they titled the Racial Equity Rapid Response Team. Westside United was asked to co-lead the team, and they applied a racial justice lens and saw an opportunity to again transfer power, money, and resources to the community. This meant, in the short run, masks, food, rent assistance, and vaccines in these neighborhoods first, and in the longer run, community investment, better jobs, and continuous healthcare. Aisha and her colleagues framed the problem around what resources were needed to help the community the most, and the city responded. And while disparities in who gets COVID and who dies from it in the city of Chicago persist, the gap between white and Black death rates has narrowed by over 30 percentage points from those initial days.
Hello everyone, I'm Mayor Lori Lightfoot. The work of Westside United over the past year has been nothing short of miraculous and truly has saved countless lives. We can say proudly that our recent success in equitable vaccine distribution is directly drawn from the lessons we learned and applied from Westside United and their guidance and partnership with the Racial Equity Rapid Response Team. But this effort is just one part of the vast impact Westside United has had and continues to have in communities across our city. As I've told my staff as we tackle the COVID-19 crisis, we are not just building temporary scaffolding on these problems, but using this once-in-a-generation crisis to help lay the foundation for a future that finally closes the chasms of healthcare access and other resources that have plagued our city for generations. My friends at Westside United, you have done incredible work. And I look forward to continuing our partnership as we finally move out of this crisis and into the recovery that is sure to follow. Thank you all so very much for your sacrifices and hard work, and please continue to be safe.
Hello everybody, I'm Oprah, and I am delighted to join you today, though virtually, in gratitude for the work Westside United has done for Sweet Home Chicago. Last year, following the devastating impact of the pandemic, I was proud to partner with Westside United to create the Live Healthy Chicago Coalition to serve those in needs throughout the city. Now, the collaboration between Westside United, Rush University Medical Center, the MAAFA Redemption Project, My Block, My Hood, My City, and 40 Acres Fresh Market complemented the work done by City of Chicago's Racial Equity Rapid Response Team. Now, I know that these organizations have been working tirelessly on the ground. Actually, people are tired, but they still are working, so it's not tirelessly. They're working in spite of being tired on the ground to help those hit the hardest by the pandemic, meeting people where they are and serving in the ways that are needed most. So my heart goes out. I say thank you for the work that you have done and continue to do. I just wish all of you, all of us, continued health and wellness for the year ahead. Thank you.
What's Westside United's recipe for success? Jaco says it's all about bringing community voice to the table. It's all about trust. The community trusts them, power trusts them, healthcare trusts them. In the Humans of New York keynote this afternoon at the forum, Brandon Stanton will interview Suhey Hernandez, a community health worker from Harris County Public Health in Houston, Texas. And they will again talk about the theme of building trust during COVID-19 and how that starts with understanding the real needs of the people in the community. Trust is the capital that Westside United is trading on, that Suhey is mobilizing to move power, money, and resources to the community that creates better health and the kind of equity that has the potential to save hundreds of thousands of lives. Back to the trust triangle again for my favorite of phrase 3 dimensions, authenticity. You cannot be good at being anyone but yourself. And it's hard to trust someone who isn't their authentic self. Of course, there may be powerful realities that prevent you from being you in every situation. But without authenticity, trust weakens fundamentally, and skepticism about intentions and motivations creep in. One of the most important aspects of authenticity is consistency. If your work persona and your home persona are different, the authenticity part of the trust triangle is probably weaker than it could be. Consistency matters in trust a great deal. There's a story in Rachel Botsman's book that caught my eye that speaks to this authentic and consistent connection. It's a story about a woman who was driving her car down a road in Australia. She came across the spot where her son had been tragically killed in a car accident some years earlier. The memory caused a panic attack in her, and she pulled her car over and couldn't drive on. And so she picked up the phone and she dialed, not her husband, not a close friend, not the police or an ambulance, but the National Roads and Motorists Association, which is the equivalent of calling the AAA in the US. And the AAA of Australia dispatched someone to come see her, and that person got to her within minutes. And then that person proceeded to sit in the car with her for the next 2 hours, holding her hand and talking to her to ease her panic until she was able to safely get on her way. She didn't have to get her car towed or go to the emergency room. She just needed someone to be there with her. And when she was asked about why she called the AAA of Australia, she simply said, "Because I knew they would come." That's consistency. That's authenticity. That's trust. The story reminded me of another one from a member of IHI's Leadership Alliance, Parkland Health in Dallas, Texas. Parkland operates one of the busiest emergency rooms in the country. And several years ago, Parkland wondered why the police and fire departments were bringing in so many behavioral health patients, often with 3 to 5 police officers accompanying them. Such a massive show of force for what sometimes required a fairly straightforward medication adjustment or a referral to outpatient psychiatric services. So Parkland began a service where their mental health social workers would respond along with police and fire to a 46, which is the 911 dispatcher's code in Dallas for a psychiatric emergency. The typical team, called the Right Care Team, would be 1 fire or police to manage scene security, 1 medic to manage any clinical issues that were at play, and 1 Parkland mental health social worker who would attend to the behavioral health issues. In a 2.5-year pilot, these teams responded to over 7,500 calls, and 28% of these individuals, almost a third, were diverted from the ER or going to jail. In fact, where this program occurred, the overall arrest rate declined by 8%, while every other section of the city saw no similar declines. Parkland's emergency room saw a 20% decline in behavioral health patients from South Central Dallas, while every other region of the city saw a massive increase over the same period of time. But the most remarkable thing about this story, and what struck me when I heard it, is that when people in South Central Dallas are having a mental health emergency, they call 911 now, and they request Parkland's Right Care team by name. That is trust. That is consistency born of authentic connection to the community. And when I asked Curtis Young, the director of social work at Parkland, what he thought was the secret sauce of Right Care, he told me another story. The Right Care team had been called to a mental health boarding house with 6 residents where the owner of the house had died. The team found the place broken down, infested and unsanitary, and the patients had to be moved right there and right then. Without Right Care, these patients would easily have been taken to the emergency room, where they would have sat for days, while hospital-based social workers would have sought placement for them, or worse, they would have gone to a shelter where they would have received no such similar care, or perhaps even a jail. But Right Care social workers placed every single one of them right there, right then. It took them 6 hours in the field and every single favor they could call in, but they engaged everyone, the behavioral health authority in the city, outpatient providers, even the city's inspectors. It was a team effort, but every single resident was placed in a new group home, and news of that kind of authentic commitment to the community took off. People call Right Care now for the very same reason that the lady in Australia called her version of the AAA, because they know they will come and they know they will be cared for when they do. Empathy, logic, and authenticity, the trust triangle that I believe we can remember and that we can use to interrupt the downward spiral of distrust that is growing in American medicine and in healthcare all over the world. At IHI, we have a lot to learn about how to build trust, but I feel more certain than ever that trust is the key driver to unlock almost every health challenge we face. We must build trust within and throughout to achieve our mission of improving human health. In the new year, IHI and the American Medical Association will launch together with the American Hospital Association, Brace Forward, and a growing group of partners and collaborators, a large-scale national initiative to transform our organizations to achieve health equity. A movement that will engage many actors in the health and care ecosystem to work together to improve care for and with historically marginalized communities. This movement will shift us from data, discussion, and diagnosis to words, action, implementation, and justice. But this initiative will only move as fast as we trust each other, at the speed and pace of trust. And that is why we will center interventions that encourage us all to get curious, transfer power, and be consistent. I believe we can begin to build trust right now. Not by next Tuesday, by this afternoon. And not just with your patients, but with your colleagues and your families. And not just with the people you know the best, but with the very next person you meet. Frances Frey says, shoulders, eyes, and question marks, by which she means sit down, make eye contact, put aside your distractions, ask questions, and care about the answer. This is the essence to building trust. Sit, see, put away the phone or pager, ask questions, and care about the answer. And the trick is to do this exact thing when you least want to do it. When your patient is angry, or you're hurrying from one place to the next, when time is against you, or when you are the most exhausted. This is precisely when you sit, breathe, make eye contact, and ask what matters, and care enough about the answer to do something about it. It's a very easy thing to say and a very, very hard thing to do. For institutions and leaders, there's an equivalent. Sit. Get out into the community and share a meal. Sit and eat and talk. In the quality world, we talk a lot about getting to the gemba, or the front lines of care. If you believe the theory that the production of health begins in the home and in the community, then the front lines were actually never the wards, ICUs, or clinics. Those are, to be sure, needed and important parts of our system. But the gemba itself has changed. Getting to the gemba now means getting into the community. Go there with empathy. Center the needs of the people you find, including your staff and their families. Get curious and get ready to learn and be taught. Aisha Jaco said, "Be ready to be insulted, to be yelled at." There are centuries of pent-up frustration and anger that we all need to hear. Go to the gemba. Ask open and honest questions about what matters and be interested in the answer. Set aside the distractions. This isn't a single community member on a committee. This isn't a health fair where we measure lipids or blood pressures. It's not about your patient portal and its uptake. This is about what the community really, really needs and what really, really matters to them, to our patients, our staff, our families, and our communities. And when you go to the gemba, be prepared to act differently, to design something completely different, like Curtis Young and the Parkland team did. And when you go, remember that you, literally any of you, can make a difference. When I was speaking with Kyle Christensen from Unity Point's new LGBTQ clinic, he told me about a study that stopped me in my tracks. I mentioned earlier that the suicide attempt rate among transgender people was incredibly high. By the time trans people reach the age of 18, nearly a third have attempted suicide. But here is the amazing thing. LGBTQ youth who report having just one accepting adult, an adult who says, "I see you, I accept you for who you are in all of your glory," having just one accepting adult in a trans person's life reduces the risk of an actual suicide attempt by 40%. 40%. And what is amazing is that single affirming adult can be anyone. Absolutely anyone. And that is why Kyle trains every single person in the Unity Point Prairie Parkway Clinic to say, "Welcome. What's your name? And what pronouns do you use?" From the doctors and nurses to the technicians, cleaners, schedulers, and greeters, everyone is trained. Because anyone, absolutely anyone, acting with empathy, logic, and authenticity can be that single affirming adult in the lives of the people that come through the doors of their clinic. Anyone can build trust. Absolutely anyone. As Kyle said to me as we ended our discussion, who will be that single affirming adult? Could it be you? Thank you, and enjoy the rest of the IHI Forum.